We've talked about heart failure as a problem, so it can be due to problems like cardiomyopathies, but it can be caused by a number of different things, and actually heart failure as an entity is very important. It affects between 5 and 6 million people in this country every year, and that problem is quite a vexing one. And there are two main forms of heart failure to think about. One is what we call systolic heart failure. That is, the pumping function of the heart is diminished for many different reasons. Either heart attack has destroyed a lot of heart muscle so the heart can't pump so well, or cardiomyopathy affects it. And in those sorts of circumstances, we call that systolic heart failure. When the heart can't beat properly, we have a number of medications that we can use to try to treat that. Again, sometimes we can't affect it enough, and things like heart transplant may be required. A particularly difficult kind of heart failure is called diastolic heart failure, or heart failure with preserved systolic function, another kind of long term for it. And that's what we see when the heart muscle gets thick, or in some cases the heart is restricted in its ability to open up and take in more blood preparatory to pumping it out. And it's often seen in diabetics, and particularly in elderly women. So we think there's going to be a greater and greater population as women age, and there's a larger aging population in general. And we don't have very good treatments yet for diastolic heart failure or failure with preserved ejection fraction. So when the heart's electrical system isn't working properly, you can have several kinds of problems. Some are fairly straightforward and easy to understand, and those are the circumstances where the ability of the heart to generate an electrical signal or to conduct that electrical system through the heart is faulty. So the heart knows that it should beat because there are areas in the heart that can actually make a new electrical signal, and that signal is dependent on the autonomic nervous system, which provides input to that area, can speed up the heart rate or slow it down. And that signal starts at the top of the heart, kind of physically at the top, above the atria, the small, thin-walled chambers at the top of the heart that function as sort of topping off pumps. So when the atria contract, they push blood into the ventricles, the main muscular chambers of the heart, and then when the ventricles contract, in response to an electrical system continuing down, when they contract, they pump blood out both to the lungs, so blood can be oxygenated, and to the body, so that oxygenated blood can actually nourish all the rest of us, the brain and muscles and such. If you have a problem with conduction of electricity through the heart, say at the AV node, the place right between the atria and ventricles, even though there may be good function of the top part of the heart, the ventricles won't know to respond, and they may respond very slowly. If that happens in people, blood pressure will fall, people will faint, pass out, can be the cause of auto accidents, can happen suddenly as people are walking across a room or driving their car or doing other activities. Over the years, we've developed very good pacemakers so that we can substitute for the electrical system of the heart. If the problem isn't caused by something that we could easily reverse, sometimes a medication can slow the heart rate down or cause heart block, and just removing the medication will fix it. But if it is a real problem with the electrical system, we have very good pacemakers. We can pace both the atria and the ventricles of the heart. We can even pace the heart in a way that responds to the activity that the person's going to do. So instead of just saying, well, we won't let the heart rate get below a certain level, we can say, we won't let it get below that level, but if you want to go and run or walk on your treadmill, we can increase the heart rate appropriately for you. So those have become much more sophisticated. The batteries have become much smaller so that we can actually put them in infants even now. So for adults, they're not much of a problem, and they work quite well and really can restore people to very good functioning. Equally important, even more important in terms of problems with the heart, are rapid heart rhythms, either those that make the whole heart beat faster, or those that occur primarily in the ventricles. And AHA staff know well about ventricular tachycardia and fibrillation, because those are the causes often of sudden cardiac arrest, and can be treated by defibrillation, either by implanted defibrillators if we suspect or know that someone is likely to have those kinds of heart rhythms, or after they've had an episode, been resuscitated, and we want to prevent the next episode from happening. And again, our treatments can be quite effective now in the modern day and age for those. So actually, if you ask any general cardiologist, the most common heart rhythm problem we see are very benign things that really are no big deal. And it's quite nice, actually, to be able to see someone who's worried about occasional extra heartbeats, and to be able to reassure them after listening to them and examining them and being sure that they have no structural heart disease, to let them know that extra heartbeats are common and really not a problem. So palpitations are what people often will describe, and many times those really have no impact on lifespan, nor do they cause any other symptoms besides a kind of funny feeling in your chest, a sort of flip-flop or a butterfly kind of feeling, but often they're not at all serious. It's, of course, very important to differentiate people who have heart rhythm problems or palpitations from something that could turn into a very serious problem from those who have the kind that really aren't problematic at all. Atrial fibrillation is one of the most common rhythms that we see now, and although that's not a ventricular rhythm, dysrhythmia, it's a rhythm that causes significant problems because it really interferes with the heart's ability to pump. The heart needs that topping off to be able to pump blood out efficiently. So if the atria are not working, if they are fibrillating, which just means that they're not having an organized pumping function, that those small thin-walled pumps are in fact kind of quivering or fibrillating, then the heart isn't getting topped off properly, and although it can pump just fine, and the cardiac output, the amount of blood the heart can pump, isn't diminished a huge amount, just having it diminished a little bit and having it not able to kick up and increase when it needs to can make people feel really fatigued and be able to function much less well. Even more important, really, because people can often learn to live with slightly decreased functioning, is the fact that if you have atrial fibrillation and the atria aren't pumping well, then in fact clots can form in the atria, and those clots can then be pumped out through the blood vessels that go to the brain and can cause strokes. They can go other places as well. The body can absorb clots a little better in other places. Even if you lose a few cells somewhere else, it's not so critical. If you lose a few cells in the brain, it can often be just devastating. So strokes are it's quite common in patients with strokes to find atrial fibrillation that actually wasn't recognized because the symptoms from it weren't severe enough to bring it to attention. We can do much better in terms of preventing a second stroke if someone's had one for that reason. And in some cases we can in fact restore people to normal rhythm, and obviously that's the ideal hope.